Hi, I'm Dr. Sarah Davies. I'm a GP and a functional medicine doctor, and I've been asked to speak to you a little bit about how I think functional medicine doctors and lifestyle coaches can collaborate together. So at the moment, I currently started off working single-handedly in practice, and when it all became a little bit too much for me, I got somebody to help with my administration. And then finally, I employed a nutritional therapist who has been a godsend. So what I have found is that working with somebody else not only helps me feel more secure because I'm in a team and I've got someone else to bounce ideas off, but it also means that I don't have to do all of the coaching work, which I'm not actually particularly trained to do as a GP myself. So my nutritional therapist will go through diet and lifestyle plans with people. She's there to hold their hands if they have problems, and then if she can't manage those problems, she will be able to refer back to me. Now, one of my problems at the moment is I have a waiting list which is getting on for 2 to 3 months. It's quite difficult to get to see me, and I have a constant clamour of people who actually need a little bit more hand-holding than I'm able to offer at present. And that's really not surprising because functional medicine lifestyle plans really are quite extensive. So we're looking at problems with sleep, we're thinking about stress, we're doing interventions with diet, we're changing nutrient levels with supplementation, and that's quite a lot for somebody who's chronically ill to deal with. And if I just give them a big list of problems for them to go away and solve, that can be a difficult thing for them to do by themselves. So my feeling is that in order for me to be able to expand and see more patients, or maybe just deal with the existing patients that I have more quickly, then it would be really nice to have health professionals involved who understand functional medicine and who understand how to help patients and also implement change. So at some point, I think my clinic would be really good to grow with the employment of lifestyle medicine coaches. And what's really lovely to see is that I've got 4 or 5 patients now who've actually trained as lifestyle coaches because they've been so amazed by what lifestyle medicine has done for them in their own lives. And these are people who are going to be passionate about lifestyle medicine and who I know are going to share that passion with my patients. So in terms of qualities of people to work alongside with functional medicine practitioners, you want somebody with experience of using functional medicine techniques personally, if possible. You want somebody who's passionate about it, and somebody who is really good with people and who's good in a pastoral role as well. A lot of our patients have multiple chronic problems, and they just need gentle guidance and a little bit of a hand every now and again when they're feeling low. Because sometimes things that we do make them feel worse, and they don't know whether that's something working and that's a good thing, or whether that's something to be worried about. In terms of my time, I ideally need a team around me who can recognise when the problems are serious and they need to come and talk to me, and when they can just deal with that themselves through their own experience and learning that that's a normal part of the functional medicine protocols. So I look forward to a future where functional medicine doctors and lifestyle coaches can work together, and I hope this has been informative for you. I think if you want to get in touch with the functional medicine doctors as lifestyle coaches, then email. Do just keep in touch, tell them what you're doing, tell them your experience, maybe ask if you can go and sit in for a day so that you can get a feel for what they do and they can get a feel for whether they like you. I typically have one doctor or other health professional with me 1 day a week. I'm trying to limit that to just twice a month because it's quite pressure on my time, but I am always happy to see people, and I'm just amazed that how rapidly the lifestyle medicine and functional medicine movement is growing at the moment, and I'm really excited for you all to join in as part of that.